Okay, so today's topic is patient safety and biohazard safety. I'll not go into much detail, but the basic thing is when a patient comes to a hospital, what he thinks is he should get all right. But the institution should not harm him in any way. So, in spite of that, well intentions, but patient safety is a serious global public health concern. There is a 1 in 300 chance of a patient being harmed during health care. And patient harm is the 14th leading cause of morbidity and mortality across the world. Do you know what is meant by morbidity and mortality? Good. So these are few of the things. Unsafe medication practices and medication errors are a leading cause of avoidable harm in healthcare systems across the world. Medication error occurs when weak medication system and or human factors such as fatigue of personnel, poor working conditions, workflow interruptions, or staff shortage affect prescribing, transcribing, dispensing, administration, and monitoring practices, which can then result in severe harm, disability, and even death. The point is unsafe medication practices and medication error. So I'll go for the second point, that is medication error. It occurs if you look for each thing, human factors particularly, such as fatigue of personnel. In MBBS, you don't see that kind of the pressure while you are serving in a clinical area, but when you go for your residency, definitely it is one of the leading cause. You will be working for 36 to 48 hours on a continuous basis, and your fatigue becomes too much to do anything, but still you are supposed to do the thing. So that time, unintentionally, it may happen, but the point is patient is suffering. Second, poor working conditions that may exist anywhere. Workflow interruptions. You are doing something, and in the middle of the things, you are being called by your professor. So what you are supposed to do? And then you come back that you don't realize that you have left the procedure in half. Staff shortage. That's the one thing which exists virtually in all the hospitals of India. If we need 3%, there will be only 2. So, but somehow we work in those conditions. But yes, definitely, this one thing, this staff shortage problem leads to so many difficulties in managing the health of the patients. Prescribing, transcribing, dispensing. Prescribing is what you are writing. Transcribing is someone else is dictating and you are writing. Dispensing means you are giving the dose. Administration, how to put inside the patient, how to monitor. And in either of these steps, there could be something. There could be a problem. I am saying something, you are listening something, and that is causing a problem. Most burdensome events include venous thromboembolism, pressure ulcer, and infections. So venous thromboembolism, when the patient is in bedridden condition, and the thrombi forms in the deep veins, and it travels to the vital organs. Because you could not mobilize the patient, or you could not give a proper occupational therapy. Pressure ulcers, patient is bedridden, so all the points where the body is in touch with the bed continuously, that area may become damaged. And infections, healthcare associated infections. These are those infections which were not present in the patient when he or she came to the institution. These are given by the institution to the patient because that flora is present in hospital, and our inadvertent practices leads to HAI. Of every 100 hospitalized patients at any given time, 7 in high-income countries and 10 in low and middle-income countries will acquire healthcare-associated infections. So 10% in a country like India. Simple and low-cost infection prevention and control measures such as appropriate hand hygiene could reduce the frequency of HAIs by more than 50%. अभी तो कोविड के बाद I think you all know how to perform hand hygiene कि नहीं? पक्का? So we will demonstrate 7 steps of hand hygiene. So hopefully there are 7 steps. I will cover them. So this is another thing, is that these are International Patient Safety Goals, IPSG. They are part of the JCI accreditation. Actually, this is Joint Commission International. There are benchmarks for the accreditation of a hospital, means the things, minimum requirements that should be present in an institution to get accreditation. So IPSGs are to promote specific improvements in patient safety, highlight problematic areas in healthcare, describe evidence and expert-based consensus solution to these problems. These are certain international patient safety goals. So identify patients correctly, improve effective communication, improve the safety of high alert medications, ensure correct site, correct procedure, correct patient surgery, reduce the risk of healthcare associated infections, and reduce the risk of patient harm resulting from fall. These things, the adverse effect should not take place inside your institution. So first of all, identify patients. You would have heard it many times कि surgery होनी थी, right limb पे हो गई, left limb पे. Person was supposed to be operated for something else in intestine, and patient was operated for something else in liver. So why does it happen? Human errors which could have been avoided, but ultimately who is suffering? Patient. So first thing, identify the patient correctly. There could be two persons of same name in same ward. So using two patient identifiers, not including patient's room or location. So Mr. XYZ in orthopedics is not a complete identification. So what you will need, a person's name and a UHID, a specific ID which is given to the patient when you are admitted to a hospital, and that is kept as a band on the patient's wrist. You are supposed to ensure that it is the same patient before administering medications, blood or blood products, before taking blood and other specimens for clinical testing. So when you go to a patient, don't assume that this is Mr. XYZ. Just ask them their name and check their UHID from their case sheet. Before taking blood and other specimens for clinical testing, before providing treatment and procedures, policies and procedures support consistent practice in all situations and locations. Improve effective communication. The complete verbal and the telephone order or the test result is written down by the receiver of the order or test result. Now suppose you are working as a resident, you are on your evening duty, and you find a patient is in bad condition. Just now you have come here, you do not know what was the situation in morning. So you call your professor, sir, one patient XYZ is having dyspnea. Now what I think, before confirming any other thing, I just remember from my memory there was a patient in morning XYZ, but he was having some abdominal problem. Neither of us is confirming is it the same patient which we are thinking, and I give okay ऐसा है, ठीक है, ये वाला investigation करो. That was first fault. Second thing, if I have given certain instructions, that must be written down by the receiver. The complete verbal and telephonic order of the test result is read back by the receiver of the order or test result. I tell you a tablet paracetamol and you write aspirin. So that's a flaw which can happen with anyone. But the point is, if you read it back to me, I will correct you at that step. If I do not check it, if you do not cross-check it, that's going to be given to the patient, right? The order or test result is confirmed by the individual who gave the order or test result. So next day when I come to the duty, I will just check what verbal order I have given in the evening, whether the person has written it correctly, and I will just verify it by my own signatures. So that's a good practice, and that reduces the number of adverse effects. Improve the safety of high alert medications. There are few medications which must be given in a very proper way. So medication, what are high alert medications? So medications involved in high percentage of error and or sentinel events. Medications that carry a higher risk for adverse outcomes. drugs which look alike and sound alike. So few examples of high alert medications are anti-infective drugs like amphotericin B injection, potassium and other electrolytes because they can just change the electrolyte levels of your body, insulin, sudden hypoglycemia, narcotics and other sedatives like midazolam, chemotherapeutic agents like vasopressin, and heparin and other anticoagulants. So these things, if they are not supposed to be used in one patient, must not be used in any situation. To improve the safety of the high alert medication, policies and procedures are developed to address the identification, location, labeling, and storage of high alert medications. The policies and procedures are implemented throughout the hospital. So like concentrated electrolytes are not present in patient care units unless clinically necessary, and actions are taken inadvertent administration in those areas where permitted by policy. Concentrated electrolytes that are stored in patient care units are clearly labeled and stored in a manner that restricted areas. This step ensures correct site, correct procedure, correct patient surgery, use an instantly recognized mark for surgical site identification, and involves the patient in the marking process. So that's a common reason. Why does it happen? Patient, okay, you have identified the patient. He was supposed to be transplanted in the right knee. So while you are marking it before the surgery, you just confirm with the patient, okay, you have come for the right knee surgery or the left knee surgery. This is one thing which very frequent happens. Transplanting in the wrong limb. So involve the patient in the marking process. Don't imagine, don't assume the things, okay, left knee, probably left knee ho sakta hai. So that's not a right thing. Patient se bhi aap pooch sakte hain, is it your right knee which was affected? He will tell you, yes, it's my right knee which is to be operated, because patient knows about this. Use a checklist or other process to verify preoperatively the correct site, correct procedure, and the correct patient, and that all documents and equipment needed are on hand, correct and functional. So you don't go to buy a pen once the exam has started. So you just cannot prepare your operation table once the patient is on the table. Everything has to be there beforehand. The full surgical team conducts and documents a timeout procedure just before starting the surgical procedure. So this is the, if the surgery remains uneventful, this is the time by which I will finish this surgery. Policies and procedures are developed that support uniform process to ensure the correct site, correct procedure, and correct patient, including medical and the dental procedures done in settings other than the operating theaters. Reduce the risk of healthcare associated infections. The organization has adopted or adapted currently published in the generally accepted hand hygiene guidelines. Basically, there are 4 healthcare associated infections. One thing is catheter associated urinary tract infection. Second is the ventilator associated pneumonia. Third is central line associated bloodstream infection, and the fourth one is surgical site infection. These are the class 4 healthcare associated infections. So one thing which can prevent them happening is hand hygiene, a very important one. So the organization implements an effective hand hygiene program in our institute. Policies and procedures are developed that support continued reduction of healthcare associated infection. So these are the 5 moments when you are supposed to perform hand hygiene. So first is before touching a patient. Second is before performing any clean or aseptic procedure. Third is after body fluid exposure. Fourth, after touching a patient. And the 5th point, which is often overlooked, is after touching patient surrounding. Patient surrounding, when a patient is lying on a bed, patient's IV stand, bedside locker, monitors, all are part of patient zone. You may enter the patient zone without, you don't touch the patient. So when you come back, you don't realize that you are carrying the flora of the patient on your hands. So that's why these are the 5 moments when you are supposed to perform hand hygiene. And this poster you will see so many places, and virtually on the all hand wash stations in the hospital. That is These are the 7 steps of hand hygiene. So if you are not performing hand hygiene correctly, it means it's not effective. You may do it, but if it's not done in a proper way, it's useless. So hand hygiene can be performed by either of the method. In one you can use an alcoholic hand rub, which you commonly call sanitizer, and second one is soap and water. So the only indication for soap and water means where it is more effective is once your hands are visibly dirty, or second when you have used a washroom, because when you are coming out of a washroom means probably the flora on your hand could be the gram-positive bacilli, and gram-positive bacilli are not killed by the alcohol. So if you have cleaned your scooty's seat with your hand, bare hand, dust, and you are using sanitizer, that's not going to help you because your hands are visibly dirty. They must be cleaned with soap and water. So many people do it. These are the 7 steps. So you take alcoholic hand rub in your hand. So first of all, wet all the surfaces of your hand. Then rub palm to palm. Okay. Then rub back with the palm on the both hands. While you are coming down, just ensure it that your fingers passes through the webs, because that must be clean. In the third step, close, interlock all the fingers and just rub them side. Fourth, now the front of the finger is clean. The thing is the folds of your finger, knuckles. So just extend them and you will move like this so that your palm is cleaning the knuckles. 4 steps. As the thumb was not cleaned till now, you will hold the thumb including the web. Okay, and just rotate it. What last remains is the fingertips. So just rub them in a circular manner. And the last 7th step is wrist. So these are the 7 steps. They must be done in the same sequence. Then only they are effective, because if you look at the picture, you are moving from the larger surface area to the smaller surface area. Okay, picture. One more thing, IPSG-6 is reduce the risk of patient harm resulting from falls. Implements a process for the initial assessment of patients for fall risk and the reassessment of patient when indicated by a change in condition of medication, among others. Measures are implemented to reduce fall risk for those assessed to be at risk, and measures are monitored for result, both successful fall injury reduction and any unintended related consequences. So these were the 6 international patient safety goals. How many of you know how to fight with the fire? Have you been trained or not? No. अभी इस classroom में आग लगेगी तो क्या करेंगे? See, that sounds very easy, but the panic which arises that time, it is too much. So these are the 2 strategies. Is there any fire extinguisher in this room? Okay, so it must be. Fire extinguishers could be of different types, depending upon what kind of means the fire is arising from which kind of flammable material. So if it is wood, you will throw water? Yes or no? So if it is from current or electricity, you will throw water. From where will you get the sand at the 3rd floor? So in that case, what kind of which thing you will use in your fire extinguisher? So in that case, we use carbon dioxide fire extinguisher. So as oxygen is necessary to burn the fire, CO2 will be useful, because on all the materials, all the flammable materials which are lighter than the wire, for example, ether, petrol, acetone, The fire cannot be doused by the water. That will spread. So these are two strategies: raise, rescue, alarm, confine, and extinguish. And then second is pass, means how to use it: pull, aim, squeeze, and sweep. And one more thing, that is, जब आप लोगों के नाम लिख के हो जाए तो मुझे बता देना, क्लास तभी खत्म हो जाएगी. बिकॉज मेरी नजर वहीं पे कि पेपर कहां तक पहुंचा है बेटा. आई होप यू विल राइट फास्ट नाउ. Every process must be incentivized. Second thing in my topic is today biohazard. So in grossly we talk about biomedical waste, because the things which are present in it. Now don't tear the page, otherwise you will have to write it again. So biomedical waste is any waste which is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities pertaining to or in the production or testing of biologicals and categories. So healthcare waste is defined as the total waste that generates from a healthcare facility. So whatever the waste is generated from Mahatma Gandhi Hospital, that will be called as healthcare waste. In healthcare waste, there are two basic categories. One is healthcare general waste, which constitute around 75 to 90% of the waste. And the second one is healthcare risk waste, that is around 10 to 25%. General waste means like paper packaging, plastic packaging, food preparations, and other items that have not been contaminated. Healthcare risk waste means infectious waste, hazardous waste, or harmful, which are harmful to the human and environment. But what happens now? Suppose if you mix the 10% with the remaining 90%, what will happen? The entire 100% becomes infectious. So biomedical waste can be generated in a hospital, nursing home, clinic, medical laboratories, blood banks, animal houses, etc. Such a waste can also be generated at home if healthcare is being provided there to a patient. In the biomedical waste, the things which can be there are like solids, catheters and tubes, disposable masks and scrubs, disposable tools, medical gloves and wound dressings, liquids like blood, body fluid and tissues, cell, organ and tissue culture, sharps like blades, either razor or scalpel, material made up of glass such as cuvettes and slides, needles, plastic pipettes and syringes. From the laboratory, there could be different type of waste like animal carcasses, hazardous chemicals, medicinal plants, radioactive material with biological components. So this is how they are classified. One more classification is the non-infectious could be biodegradable or non-biodegradable. That was the whole concept behind keeping the dry and liquid waste separately. Infectious could be sharps and non-sharps. Non-sharps could be either solid or liquid, and solid could be incinerable, which can be burnt, or non-incinerable, which has to be treated with an autoclave or microwave. So the best thing is, as I said, if you mix the 10% with the remaining 90%, the entire 100% becomes infective. So what's the best strategy is to segregate the waste at the point of generation itself. That's why we keep those 4 types of containers. That is, one is black, that is for general waste. Another one is in hospital, no white bin is used, no green, it is yellow. Yellow goes for virtually for all the infectious material. Then red goes for the infectious material which is recyclable. And then comes a separate category for the sharps, which have a translucent or a white container where you will keep it, or a blue one with a white with a blue strip where you keep the metallic sharp. So this is the latest biomedical waste management tool which was given in 2016. Segregation, that is preferably at the point of generation. Color-coded bags or bins are used. It helps in safe handling and transportation. These are the color codes. Now the categories are colored nowadays. These are the different methods of how are you going to finally treat it. So once you are in a hospital, please take care that whatever you are throwing, because bad habits, people do not segregate the waste very in a proper way, particularly doctors. So make sure you do not behave in such a way. These are the very few basic things about patient safety and biohazard safety. One thing, always take care of your patient. Just because of your laziness, your patient should not suffer. Okay? Thank you.